into TV storylines. Now, if you think about film, a film can take 5 years to develop, so that eliminates the timely aspect of our mission, right? The other thing is a lot of movies never make it to the screen. So we could invest a lot of time up front over 5 years, giving lots of in-depth, health information, and not have a result. And with television, the turnaround time is very short. We can see an episode in 2 months on the screen. Sometimes it takes 6 months. Sometimes they sort of file away an interesting topic and it doesn't show up for 2 years. But we just have a much better turnaround with television.
Well, the reason I ask about film is because everyone always refers to a movie like one scene, like let's say like Rambo or like
Right.
Arnold Schwarzenegger, and it's like, if I jump off this building, I can survive. And it's
Yeah.
like, let's say like one of the horrible scenes in a hospital, and it's like, I could probably stab myself and I'll survive, or something like that. And it's like, most of the kids will watch it and they'll
Right.
think those things, and it's like, it's pretty horrible.
Right.
That's why.
So it makes it entertaining.
That's why it makes it entertaining. But
You're right, and so I guess the answer is there is a lot of value to working with filmmakers as well. But we do that very selectively just because it's very time consuming. Yes.
Because you get funding from the CDC and the Bill and Melinda Gates Foundation, et cetera. Like when you go to these script writers and you bring the specialist in, is it a service you provide, or is it like, okay, we're coming, but you need your check ready when you get there? Or the packet, like how does that work?
Okay, that's a great question. So Hollywood Health and Society has this independent funding. We're a nonprofit organization. We have partners like the CDC. You can't get much more credible than that. We all have public health degrees. So, we're not competing to be on camera, to be the stars, to get our names in the lights. We so know our role, and that's what makes it work. And that's why we have the only sustained and systematic program of its kind that I know of anywhere in the world. And it's because of these lessons learned and this model.
Let's do one more. Richard.
Yes.
Two questions, actually. The first is there was a lot of popular media response to programs like CSI that pointed to law enforcement and especially prosecutors being really frustrated because these shows would dilute a fairly complex process into 1 hour, and they were finding that with victims especially, there was a lot of backlash because they were saying, how come you haven't, CSI solves these problems in an hour, how come you haven't been able to pursue this case? I'm wondering if either in the post-test or maybe in the way that you talk to the writers, there isn't some risk of simplifying some of these problems to the point that somebody would say, well, I may have this or this may be an issue, but surely I should be able to wrap it up in 40 minutes the way that the House does or the VR does.
Right.
And sort of the corollary to that is in the post-tests, it also seems that there's a risk with, when you've got the media website set up or the reaction websites, that also opens the door for people finding just as many websites that are a little bit less on the level or more sort of in the line of pop medical assistance. Right. Have you found any of that in the post-test evaluations?
Those are great questions. And it's interesting, I don't need to talk into this, I keep forgetting. That's one of your first question about these shortened time frames and somewhat unrealistic framing of issues is a question that's often posed to the writers. We have these panel discussions, and members of the audience often ask that. One thing I've heard writers say is, we can guarantee you that the time frames will always be compressed. They'll never be real. So a process that could play out over a year and a half is going to play out in 3 days, on our TV timeline. That's the nature of television. So it is unrealistic, and that's part of it. The thing is, and the other part is that what drives the writers are not health educators, they're not educators. They're there to tell compelling stories, compelling dramas, and compelling comedies. So we understand that, and we embrace that. We're not trying to get them to be what they're not. And that, I think for people with, say, public health goals, You know, we're used to having these public health campaigns where we actually tell the story the real way, and we have control. We co-produce it, or we produce it, and we have the long time frame, and we show the real outcomes. But when you look at our budgets, we can afford to reach, maybe in a developing country, we can reach a country. But in the US, we might reach a regional group, a state group, a community. Very rarely can we reach a national audience in the US using a traditional approach. So they're not the same thing. And we can't expect this, a public health campaign result from a TV storyline. It's apples and oranges. So what we do is look at the power of entertainment media, the fact that these episodes, one episode can reach up to 20 million people in a single hour, and that people, when there are characters that are carried over throughout a season or many seasons, viewers fall in love with them. They see them as members of their family, as their friends, and they really come to care about what happens to them. And when that happens, they become transported by these storylines, and it creates this incredible openness to learning. And so when we can drop in there, when we can encourage writers to include some accurate health information, and when we can pair that with either a public service announcement, which is always our dream come true when it happens, that's aired at a dramatic plot point, and we point them to credible sources of information, we know we're having positive impact. It won't be perfect, because that portrayal won't be perfect. And yes, there are people who use search engines, Google, Yahoo, and they're going to go to whatever site they go to. But we've still done our jobs. We've pointed people to credible sources. We have one coming up soon on bipolar disorder among teenagers. It plays out over a 6-week period, so it's many segments, many episodes, and it's in a show for young people. So we're partnering with the SAMHSA, Substance Abuse and Mental Health Services Administration in Washington, D.C. They're setting up a special website. They're putting together special call-in hotline numbers. They're having Spanish and English. They're working with us. It's not going to be perfect, but millions of people are going to see this over weeks. And we're going to be there. The network's letting us do a PSA. We're having a lead actor. She's this wonderful character, you know, act in the PSA and refer young people to these resources. It's something, and it's something very powerful. Not perfect, and not a public health campaign, but worthwhile.
I think on that wonderful note, if you would join me in once again thanking Sandra de Castro Buffington.
Thank you. Thank you.
And Sandra, we hope you come back.
Thank you very much, Arvind.
I also want to thank Roland, who's sitting behind, who provides us with this beautiful auditorium. This is the 4th time that we are using it in the past 3 months. He opens his heart and does the technology for us. To Bobby's excellent crew, Laura and Gabi and Lydia. Stan. And others who help us record these events so that there's a shelf life and we can revisit them. And of course, to the audience, I see many people who've come back, and I see many new faces. And we, of course, encourage you to keep coming back. No, I mean, this is your series. It's not Sandra's. Sandra does this work all the time. But we are privileged indeed that we all can come together to this auditorium. And of course, once again, thanks.
Thank you.
Sandra. Yeah. And may the informal conversations continue. And thank you all, each one of you, for coming.